Dr. Ritika, all yours.
Namaste. Good morning, everyone. I'm Dr. Ritika Shah. A very warm welcome to each one of you who have been able to join us today for the celebration of Ayurveda, World Ayurveda Day. The purpose of World Ayurveda Day is to create awareness about Ayurveda. Today, on 2nd November 2021, marks the 6th World Ayurveda Day. We would like to start the event with the blessings of Lord Ganesha and Dhanvantari. I would like to invite Dr. Rajesh for Dhanvantari Vandana. Please note a sincere request to all the attendees to please keep your videos off and audio on mute. Over to you, Dr. Rajesh.
Thank you, Dr. Ritika. We start every work with an invocation of Lord Ganesha because he is believed to be the remover of all obstacles and negative energy. So with this thought, let's start the invocation of Lord Ganesha. Om Gam Ganpataye Namaha Vakratunda Mahakaya Surya Koti Samaprabha Nirvignam Kuru Me Deva Sarvakaryeshu Sarvada. In Ayurveda, before starting any function, any ritual, we pray to God Dhanvantari. By recalling Dhanvantari, we can increase our willpower, concentration, and make mind fresh and calm. Keeping all these benefits of Dhanvantari prayer, let's begin today's seminar with Lord Dhanvantari's prayer. Shri Dhanvantari Istavan. Om Namo Bhagavate Mahasudarshanaya Vasudevaya Dhanvantaraya Amrit Kalash Hastaya Sarva Bhaya Vinashaya Sarva Roga Nivaranaya Trilok Pathaya Triloknathaya Shri Mahavishnu Swarup Shri Dhanvantari Swarup Shri 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 Oshad Chakra Narayanaya Namaha Om Dhanvantare Namaha. Thank you.
Thank you, Dr. Rajesh, for reciting the divine lines. Thank you so much. This year, Council of Ayurveda Research, USA, and Ayurveda Anusandhan Abhiyan Foundation, AAF, India, are hosting a panel discussion on the topic Evidence-Based Ayurveda for Common Ailments, and an open community forum to celebrate World Ayurveda Day. I would like to now invite Dr. Pratibha Shah, the founder and president of Council for Ayurveda Research, to give us her inaugural address. I would like to introduce Dr. Pratibha Shah. Dr. Pratibha Shah is a BAMS, MD Ayurveda, and MPH. She's an internationally renowned Ayurveda expert. Her pioneering initiatives in the field of Ayurveda have brought her attention at the White House, the Department of Health and Human Services, as well as the Consulate General of India at NYC. For her work, she was nominated in the top 20 Women of the Year for the year 2014. Before moving to US in 2004, she was working as Chief Medical Officer with the Central Government of India in the Ministry of Ayush. In 2019, she was featured in an international documentary on Ayurveda. She is the founder president of 2 non-profit organizations and the CEO of My Ayurveda LLC. Over to you, Dr. Pratibha. Thank you for joining us.
Thank you, Dr. Ritika. And I'm going to request Dr. Ritika, if you could keep an eye on the people coming in and admit them.
Sure.
Thank you. So on behalf of Council for Ayurveda Research, I would like to extend a very warm welcome to all the Ayurveda scholars who are speaking today, all the attendees who have joined us from around the world, and my team members. November 2nd was Dhanvantri Jayanti and Dhanteras. We celebrate this day as Ayurveda Day, a term that was coined by the Ayush Ministry in 2016. The goal of Ayurveda Day is twofold: to pay respect to our science, heritage, lineage, and traditions, and to spread awareness about Ayurveda through community events. Last year, we were part of a mega initiative on Ayurveda Day, where 60 plus organizations, 10,000 plus individuals across 150 plus locations, spanning 75 plus countries across the globe, synced in to celebrate one of the biggest gifts to mankind, the health science of Ayurveda. This year, in line with the same stated goals, we are showcasing 6 young Ayurveda scholars who will be presenting about current research in some of the common ailments. Now, a few quick words about Council for Ayurveda Research. CAR is a pioneering initiative to promote and establish Ayurveda as an evidence-based health science globally. One of our core goals is to create a platform for the exchange, interaction, and integration of information, competencies, expertise, and resources between apex academic institutions, researchers, practitioners, and students in US as well as in other countries to facilitate Ayurvedic research of the highest global standards. And our long-term goal is to become the nodal agency for Indo-US collaborations and collaborations with other countries in the world and initiatives for research in Ayurveda with the ultimate aim of establishing Ayurveda globally as a credible healing science. Headquartered in USA, we now also have a sister organization in India as of 2019 in the name of Ayurvidya Anusandhan Abhiyan Foundation. So at present, we are an international nonprofit with registered presence in India as well. Please check us out at www.ayurvedaresearchusa.org. Once again, the website is www.ayurvedaresearchusa.org. We encourage everyone to become members and take part in supporting the pursuit of evidence-based Ayurveda. With that, over to you, Dr. Ritika.
Thank you so much, Dr. Pratibha, for your insightful and such encouraging words and for setting the context for today's event. Before we begin the panel, I would like to invite Dr. Archana to make a couple of announcements. Over to you, Dr. Archana. Dr. Archana?
Yes, I'm coming.
Okay.
Thank you so much. Okay. To celebrate World Ayurveda Day, CAR is also engaging students and professionals with a research idea contest. Research idea contest is an opportunity to share your original novel research idea related to any area or aspect of Ayurveda. The goal of this contest is to inspire and engage the next generation of Ayurveda to identify novel ideas and directions for solution-oriented outcomes in Ayurveda. Participants are expected to share only new and original ideas. 3 best research ideas will be selected by a contest committee for the winning prize. To participate and for more details, please email us at ayurvedaresearchusa@gmail.com. We are also providing the link to participate in the contest in the chat box. Please copy, paste, and save it. There's another important announcement that we would like to make. Moving forward, attendance certificates will be given only to CAR and AAAF members Please note again, attendance certificates for our members only. CAR or AAF membership are super nominal. To become a member, just go on our website, www.ayurvedaresearchusa.org. Click on your country flag, click join, select your category and follow prompts. We will honor all member enrollments done by midnight today, November 6th, for the purpose of attendance certificates. You can also check the chat box for membership links. Thank you. Over to you, Dr. Ritika.
Thank you so much, Dr. Archana. We hope to grow our CAR and AAF family. I would now like to invite our panel moderator, Dr. Vandana Baranwal, to start the panel discussion. But before that, please note, if you have any questions for the panelists, please post them into the chat box along with the name of the panelist. We will ask those questions after the panel discussion. I would like to now introduce Dr. Vandana Baranwal. Dr. Vandana is an Ayurveda physician, educator, speaker, and a published author of 2 books. She specializes in women health and has founded Ayurveda 3. She is the founder and president of the Ayurveda Association of Ohio and also is a member of the board of directors at the Council of Ayurveda Research. She will be joining us from Dublin, Ohio. Thank you, Dr. Vandana. Over to you.
Thank you, Vaidya Ritika, for the introduction. Namaste to everyone. Thank you, Council for Ayurveda Research and organizing team for the opportunity. It is a great pleasure to be here and moderate this session this morning and evening in India to celebrate Ayurveda Day. The importance and significance of Ayurveda Day for the Ayurvedic fraternity and common people was highlighted by Dr. Pratibha in her inaugural address. Board members at the CAR this year wanted to give young dynamic Ayurveda professionals an opportunity, a chance to take charge of the Ayurveda Day celebration and organize the event. Evidence-based Ayurveda for common ailments. It is an open community forum. I would like to congratulate the organizing team, Vaidya Ritika Shah, Vaidya Archana, and Vaidya Rajesh for their good work and wonderful execution of the plan. They have done a wonderful job. The goal this year was to explore current research to support Ayurveda for common ailments and most importantly, keep the session interactive. It is an open community forum. So this event is not just for Ayurveda professionals, but for all Ayurveda enthusiasts. And we already know mere reference to classical text is not sufficient, and scientific validation has its own value and importance. So it is very important to bring scientific rigor to Ayurveda and support it with research evidence. And at the same time, without compromising the Ayurveda and its principles. So today we are going to do the same. I have a full panel here and our esteemed panel today will share their current research behind common ailments. We are going to use our time well and we are going to break this into 3 distinct chunks. I will introduce the speakers, then invite them for their presentation, and then the forum will be open for question answer round. And we will conclude the event later. So I have the profound privilege to introduce our panelists today. Please welcome Vaidya Somit Kumar. Vaidya Somit Kumar is a BMS, MD in Ayurveda, PhD. He is the Chief Scientific Officer and Director of Research at Arya Vaidyashala Pharmacy, Kerala in India. He has worked on numerous research projects and has been a speaker at various international conferences. He is going to talk about rheumatoid arthritis and COVID management through Ayurveda. Our next esteemed speaker is Vaidya Hina Bhatt. Vaidya Hina Bhatt lives in Atlanta. She is founder and executive director of Pramukh Ayurveda Center, one of the board members of Patient and Family Advisory Committee, Atlanta, Georgia. She is an Ayurveda physician, yoga therapist, Reiki master, and is a published author. She is going to talk about post-traumatic stress disorder and eczema. Our next esteemed presenter for today is Vaidya Sanjay Tamoli. Vaidya Sanjay Tamoli is BMS, MD, Ayurveda, Director of Target Institute of Medical Education and Research, Mumbai, India, a CRO engaged in conducting clinical trials primarily on Ayurveda and natural products. He is going to talk about diabetes and its complications. He will focus on two main complications, diabetic foot and diabetic retinopathy. Our next esteemed presenter for today is Christian Rackwiz. He is Medical Director for General Medicine, GP, and Emergency Medicine, Medical Studies at Charité University Medicine, Berlin, doctoral thesis at German Heart Center, Berlin, Charité University Medicine, Berlin, Research Coordinator Ayurveda Studies at European Academy of Ayurveda. He is going to talk about osteoarthritis and basic research. Our next esteemed presenter for today is Vaidya Ashwini Godbole. Vaidya Ashwini Godbole is an associate professor at the Center for Ayurveda Biology and Holistic Nutrition. She was a principal investigator at Institute of Ayurveda Integrative Medicine, Bangalore. Her research interests include experimental research in Ayurveda neurobiology, community-based clinical research in cognitive enhancement. She is going to talk about cognitive impairment and neurodegenerative diseases. Our next esteemed presenter for today is Vidya Bhushan Pandey. Vidya Bhushan Pandey is BMS, MD in Ayurveda, currently pursuing his PhD. He is also assistant professor in the Department of Ayurveda Pediatrics at Government Ayurvedic College and Hospital in Chhattisgarh, India. He has been a speaker at various national and international conferences. He is going to talk about cerebral palsy and malnourishment. Now, I would like to invite our first speaker, Vaidya Somit. He is going to talk about rheumatoid arthritis and COVID management through Ayurveda. Over to you, Dr. Somit.
Thank you, Vandana ji. I hope I'm audible.
Yes. You can start now.
Yeah, thank you so much. And so basically coming to the point, I'm going to speak about a specific area of rheumatoid arthritis where we have been working for last almost 4 decades. Way back in 1977, AVP research initiative started scientifically assessing Ayurveda and its efficacy in rheumatoid arthritis. And with visionary leadership of Dr. Krishna Kumar ji, we could get a WHO funding. And that time, customized Ayurveda therapy was a taboo. And what was the outcome of our first research? That not single drug is effective because there was a combination of basic medicines which changed over time and all. It did give an outcome, but they couldn't figure out a single medicine which worked in isolation. So it was a great challenge that, Dr. Ernest Ernst, he wrote a systematic review article in 2005 stating that there is considerable lack of evidence in treatment of rheumatoid arthritis. And taking this as one of the important inspiration, we devised a very unique randomized double-blind placebo-controlled trial where we studied methotrexate as a standard group, as well as with placebo Ayurveda, and the other 2 groups which had true Ayurveda and placebo methotrexate, and the third group having both Ayurveda and methotrexate true group. So what we found out that can RCT be a gold standard also to assess this complex mechanism? And that was one of our major kind of step we took, an initiative, and we proved that blinding is possible and we can make placebo in Ayurveda also, provided to the rigor study design. And we proved that in this study that within 36 weeks, the patient's DAS disease activity score was very much similar to methotrexate, which had placebo Ayurveda group. The disease activity modification was same at 36th week. So what was the outcome of this study is, first, Ayurveda can be studied in such a RCT design, which is quite kind of, we all often debate is inflexible, but there is a way out. Second thing, what we found out, at least 36 weeks of continuous medication for rheumatoid arthritis, uninterrupted medication is required when you go a customized way. Now, what was very unique when this Journal of Clinical Rheumatology, it was published, it was called as a blueprint for placebo-controlled double-blind complex individualized intervention. And guess who gave a commentary on it? Mr. Ernest himself. He talks about that after reading this article, he gives a commentary that the study might therefore be used as a blueprint for testing efficacy of similarly complex intervention. So what was the major takeaway? And in fact, European award was given for in 2012 Excellence in Integrative Medicine Research Award to this study. And what we demonstrated was that if the trial is robust, the study design is customized according to your research question, then you can also follow the rigors of RCTs. Second thing, what we did was, with this as our inspiration for the next step, now we are in collaboration of CCARAS, we have started the same study design, the complex intervention at 3 centers, a multi-centric trial we are going to start with support of CCRS and Ayush at 3 centers in Bangalore, Mumbai, and Coimbatore. So this is our next level where a single-centered RCT is now getting replicated into multi-centric RCTs. So what one of the very important other takeaway of this study was, this study was funded by NIH, not any Indian institution. NIH was one of, so we received the first ever grant for this study, and Dr. Daniel First, he's a noted rheumatologist in US. He headed this study and we could make it. So this was all about, as to, if you look at customized Ayurveda therapy, it's very important that you have to keep the basic core principles of Ayurveda, and within the ambit of this, you can make a lot of innovative study design. And these days in cancer research, it is very much now known that platform trials, basket trials, outcome trials, there are many study designs which are also approved. So we have to think out of box and create new precedents. The second disease which I would like to talk to you about is COVID. Of course, this area is quite debated now. So we have done 2 organized clinical trials. The first study at Stanley, where Dr. Abhishek was also part of our team. And then we did a controlled clinical trial. There was no placebo control because unethical. We didn't get the approval, but we did a prospective control clinical study on first trial on mild to moderate cases, and the second at PSG, which we are currently also keeping on doing, is on moderate to severe cases of COVID, and only for high risk group. So we, in the first study, which is now over and the reports have been submitted to Ayush and is under review from them, is we took 48 patients divided into 2 specific groups, and we found out the best part was that and they were all diabetic. So they had uncontrolled diabetic of average of 10.23 in the experimental group. And similarly, if you look at the baseline sugar level for the allopathic group is 9.44. So it's equivalent, statistically insignificant change. What we could see, and also the age, is average age was almost 54 in study group and 56 in the control group. So they were also age matched. And what we saw was that we could reduce the number of days in which swab negativity happen after medication. So of course, it was on median average was within 9 days itself, you can make swag negativity, and 10.3 days if you are not giving Ayurveda. But this was not our major outcome. What we found out was, I'll talk to you, we were working on the IL-6 inflammatory cytokine storm. The second study which we are doing right now is on moderate and severe cases. And what we see is the frequency of ICU admission in both groups is, of course, in Ayurveda group, we see that it's a little better than the ICMR group. But where we see a marked difference is death rate. So in ICMR group, you have higher death rate, and the Ayush group is less, that is almost 3% in the Ayush group, as well as CMR, we have 18% death rate. Now, if you look at what we did was we were trying to understand these markers, basically NLR ratios, because so we did at 0 day, 14 day, 28 days, up to 68 day in our second study. So we are doing also long-term follow-up of these patients, how they respond to integrative care, or if they are not in control group, only allopathy. So what we see is there's a marked difference between the means of NLR even in both groups. That means 14th day and 28th day. And mind that the research which was recovery trial stated that if you give steroids in only severe case, it improves the 28-day survival. They don't ever tell about what happens after 28 days. So many people also succumb to fatalities after 28 days. So we are following it properly up to 28 days, and we see that there is statistical significance on 28 day between both the groups, both in mild, moderate to severe case, as well as mild to moderate case in both the studies we found out.
So 1 minute left.
Yes. So neutrophil count also very unique, because neutrophils are very important markers for mediation of your cell mediated immunity. So if you see neutrophil modulation is better in Ayurveda group, and IL-6 inflammatory cytokine storm. In both studies, we found out that there was significant curbing of inflammatory cytokine, whether 7th day or 14th day. In both the studies, we found out that the cytokine storm buildup in integrative management was better. Even C-reactive protein was shows changes. In second study, in severe case, it shows more profound change between the two groups. So what we have been trying to see that in both this study, the one thing which was common was customized approach to treating Ayurveda with classical approach of Dashvidha Pariksha and Samprapti Vighatana Chikitsa, what we say. So we basically attack the pathology with a proper diet, lifestyle, and of course, the rheumatoid arthritis study is basically an outpatient model where people are not staying with us. And we could see that with due course of proper documentation and follow-up within 36 weeks, we can moderate the, of course, there are a lot of herbs and a combination which are used. It is all in public domain. You all can refer those things. But what has been our basic contribution in this field is that customized approach, which is seemed to be one drug and one disease always for a research, may not be ideal way to prove Ayurveda's efficacy, because we know there are a lot of factors like Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vayam. All these factors do impact, and you have to customize that according to that. And even in COVID case, we have seen that it is an inpatient therapy. In that also, though we couldn't I want to state that we couldn't have a say on diet, but yes, diet after, in follow-up after discharge was followed. And we could get a very important observation that attack the host immune response rather than virus. And that works better in modulating the cytokine markers. Thank you.
Thank you, Dr. Vaidya. Soumitji, it was very insightful. And I will bring the main points while I'm concluding. Now I would like to invite Vaidya Hina Bhatt for her presentation. She is going to talk about post-traumatic stress disorder and eczema. Welcome, Dr. Hina.
Thank you so much, Dr. Vandana. I just wanted to make sure Dr. Ritika is ready, but I can get started. Namaste, good morning to US, good evening to India, and namaskar to everybody in between. So my presentation is mainly based on the case studies. I'll start with the first one. A 67-year-old male with uncontrolled type 2 diabetes was referred to endocrinologist for further evaluation and was a potential candidate for starting insulin. However, before going that route, family decided to see an Ayurvedic doctor and ended up with me. So many of you may know that Ayurveda has the most comprehensive whole system approach leading to personalized healthcare, now also known as precision health. And root cause analysis is at the core of any authentic Ayurvedic clinical practice. While history taking, I found that this gentleman was pretty healthy and lived a very disciplined life with very good diet and lifestyle. After his diagnosis, he followed all the recommendations from his registered dietitian and was regularly taking his prescription medication. There was no family history of diabetes or heart disease. Now, while digging further in the history, at one point, he and his wife had tears in their eyes. And they said, "Doctor, no one has ever asked this question before." While answering to those questions, I found out that just 4 months before his diagnosis or a label as type 2 diabetic, he had experienced a devastating emotional trauma. He lost his only grandson, a teenage boy, to an accident. Now, this is a classic example of delayed onset PTSD leading to psychosomatic disorder. I would request Dr. Ritika to get to the slides. The first one. Thank you. Statistical studies in US shows that 70% of adults experience at least one traumatic effect in their lifetime. And of those, 1 in 13 will develop PTSD at some point in their life. Next slide, please. It usually presents itself with co-occurring conditions like depression, anxiety. Next, please. Thank you. Now, recently, pandemic and other natural disasters are also added in the list of causes for PTSD. This is a very important point, especially in this era. Next, please. So PTSD is just one branch of a huge tree that has trauma at its roots. A recent study also emphasizes that PTSD is not simply a psychosocial disorder, but one underpinned by a major neurobiological disruption. Here where Ayurveda excels, Sattva-Vijaya Chikitsa, also known as Ayurvedic psychotherapy, is intricately woven in Ayurvedic management plan in such cases. The article that I shared earlier, an original article published in International Journal of Yoga, has very effectively explained the scope of Sattva-Vijaya Chikitsa. It's a non-pharmacological approach aimed at control of mind using yoga therapy, asanas, pranayam, and counseling, of course. It's a factual knowledge of psychological self-control. However, in spite of very effective usage in clinical practice, no data is available to investigate the effect of Sattva-Vijaya Chikitsa, which is very well written in Charak Samhita Sutrasthana. I would move to the next segment, which is eczema, of course, also known as atopic dermatitis. May I have the next slide, please? Thank you. Starting with its prevalence in US, an epidemiological study found that 86% of those affected by eczema have reported that they were not satisfied with the treatment. 36% of those were diagnosed with anxiety or depression. Coming to the case study again, an 11-year-old boy recently diagnosed with eczema after following prescription medication guidelines from his primary care provider, visiting various specialists. Mom decided to explore Ayurvedic approach. And of course, again, ended up with me. So remember the keywords, root cause analysis? He had a very unique pattern of flaring up on particular days of the week with uncontrollable itching. Detailed history taking revealed emotional trauma again of losing his very dear grandpa and not being able to attend his funeral due to the pandemic. Again, while following a classic Ayurvedic management plan with diet, lifestyle changes, and combination of ekal dravyas at different stages of the condition. Sattva-Vijaya Chikitsa was really the savior for this boy. May I have the next, please? Thank you. So this particular figure from National Center for Complementary and Integrative Medicine represents how integrative medicine like Ayurveda works at different levels: psychological, physiological, biochemical, and even epigenetic levels. For those who are new to this term of epigenetics, it is a very fancy term, by the way. CTC explained this in very simple words. Epigenetics is the study of how your behaviors and your environment can cause changes that affect the way your genes work. The red arrows in this figure indicate different initial levels at which integrative medicine can exert its action so that the final action is exerted at the epigenome. An altered epigenome then produces beneficial effects at different levels indicated by green arrows. So this approach can work at different levels through a specific hierarchy or at different levels simultaneously. Now, some approaches can first act directly at the epigenetic level, surpassing the psychological and physiological levels. Very good example is the use of curcumin, material medicine, to treat cancer. Conversely, some approaches might first act at the psychological level and work their way downwards into the epigenome. Now, Ayurveda can act directly on the epigenome because it works together as a whole system approach. The article published in Journal of Ayurveda and Integrative Medicine about the case report on recurring dyshidrotic eczema management with Ayurvedic Chikitsa is another a very classic example of this approach. Just to go a little further, meditation works at psychological level first. Yoga is an example of a modality that operates at the psychological and physiological levels simultaneously.
It's a small gentle reminder.
Sure. And your reminder was perfect on time because I'm done.
Thank you.
Thank you so much.
Thank you, Dr. Reena. It was a wonderful presentation, and Doc, you finished on time. And like Dr. Sumit has highlighted, no single drug is effective. You highlighted that addressing the root cause is core to the therapy. So I will put some highlights of your talk in my conclusion, but I would like to invite, thank you so much. I would like to invite our next speaker, Vaidya Sanjay Tamoliji, who is going to talk about diabetic foot and retinopathy. Over to you, Dr. Sanjay. Welcome. You can start your presentation.
Yeah, thank you very much. Could you just enable my screen sharing option? I'm not able to share my screen.
Yes.
I'm doing it.
So first of all, I would really thank the organizers, CAR, to invite me to this presentation. And it's been my first association with CAR, and really look forwards to getting more and more insights and more like say interactions in future, so that whatever I have been doing over these 20-25 years into core Ayurveda research could help the community at large and the science as well.
Go ahead. Thank you.
So able to see the screen?
Yes.
Okay, thank you very much. So with this thanks, I would like to directly start with my presentation. And this presentation is basically on the work that that we have been doing as a company also, and as a group, on different diabetic complications, different diseases, different conditions which diabetes presents over a period of time. So two conditions that I will be discussing today are diabetic retinopathy and diabetic foot ulcers through Ayurveda interventions. This has been very close to my heart, because I have done everything in diabetes complications only over these last 20 odd years. So first complication that we will be discussing would be diabetic retinopathy, and then the second would be diabetic foot ulcers. So as everybody knows, primarily diabetic retinopathy is a very chronic kind of a disease, a very progressive, potentially sight-threatening disease. In fact, it is one of the leading cause of blindness in many developed countries as well, including US, even up, like say, and it's a preventable cause basically. So it's very critical that we take care of this. The three primary reasons for this disease happening is, number one is definitely the poor glycemic control that one has, and over a period of time, the oxidative stress that happens, leading to this very dreadful complication of diabetic retinopathy, where you have a lot of leakages happening through the blood vessels, then some exudates forming, etc. Not going to the details of that. Then the second complication that we will discuss today is diabetic foot ulcers. That happens to a very large population again, but fortunately, with very good treatments and antibiotics coming into play, we do have those cases reduced. But at the same time, as age progresses and as diabetes also progresses over a period of time, this complication also becomes very dreadful. And in fact, we lose our toes, our fingers, and the leg at times to amputation. So these are the two critical things that we'll be discussing. So as far as diabetic retinopathy is concerned, I'll share with you animal study that we had done on diabetic retinopathy. This is part of a reverse pharmacology study, where we wanted to find out the findings that we were able to get in clinical research, as to like when it is effective, when a drug like Vasant Kusmakaras, a very classical formulation, is effective in diabetes management, and how it is effective, why it is effective, what changes it is bringing about in the system or in the body, where we were able to show the exact mechanism, I would say, to a great extent. So that was one of the studies that we will discuss. The other study is basically a diabetic foot ulcer. This is a clinical research on two classical Ayurvedic formulations, which everybody knows, Panchavalkal and Jatyadi Tel. But at the same time, the problem with these two formulations, or these two compounds, was that the cumbersomeness to make them, to administer and then to use, etc., and then the sterile environment, etc., to make them. So what we had done is we have converted these two into very stable kind of sprays, so that now there is no touch, there is no intervention by hands, etc. And then it's very sterile kind of an environment. And then we wanted to study these two compounds as to their effect on diabetic foot ulcers. This study is registered with CTRI, and this was sponsored by one of our sponsors, Millennium Herbal in India. So coming to the first part, that is the clinical study on diabetic foot ulcer. So this was a randomized, open-label, multicentric clinical study. It was recently completed, and it is under publication now. Very soon it should be published. It's already in the preprint, so this was a comparative study where we compared between two groups. One group where we were able to give the conventional treatment, as in the normal treatment which every allopathic medicine would give, dressing with hydrogen peroxide or sodium hypochlorite solution for the purpose of cleaning, and then and then the commonly used povidone iodine for the purpose of dressing. The Ayurvedic intervention group received cleaning with Panchavalkal Quat spray, that's called as PKS, and the healing, for the purpose of healing, we used Jatyadi oil spray. So this was a 90-day study. While the study was for 90 days, but as far as the outcomes are concerned, so those who recovered within before 90 days were considered to be completers cases. Most important thing in this study, we used lot of intervention, or a lot of methods or tools for assessment of these ulcers. Very common amongst them was the graph paper assessment, and there is a formula to calculate the area of the ulcer, because the ulcers can be not essentially square or round or something of that kind. They may be very irregular, so we use different methods to do that. There is a beautiful scale which we use in clinical research, that's called as Betz-Jensen scale. We use that scale to understand the depth of the ulcer, the undermining, the edges, etc. Then we had these digital photographs being used. These are clinical digital photographs, again, to evaluate different stages and different size, color, skin, etc., skin of the ulcer, etc. This is a very complex table, but to make it very understandable to you, is like, say, these are the four ways of analysis or assessment tool that I had discussed in the last slide. So this trace paper by formula, by Betz-Jensen, and digital photographs. So what you will find over this period of 90 days is there is a significant reduction from the baseline, that is the day 0 to day 30 and subsequently to day 90. This was observed in both the groups, not that the conventional treatment did not show any effect, but that the purpose of the study was to evaluate if there was a difference between conventional medicine and the intervention that we had. And to be really happy to, and with pleasure, I would like to share with you that these Ayurvedic interventions acted as good as the conventional treatment that was offered to the other group. On all these scales, in fact, by the trace paper, by the graph paper, the Betz-Jensen scale, and the digital photograph that we were able to take it. Other important thing was the number of days required for healing. So the number of days required for healing was found to be significantly better with the Ayurvedic intervention as compared to what it was with the conventional treatment. So this is a very complex one, which I tried to make it as simple as possible in this. This is one of the pictures that I would like to share over here. There are many of them, but we have restriction of time. So this ulcer, which is there, if you can see over here, and then there is a complete healing or resolution of the ulcer with the use of Panchavalkal and Jatyadi spray. The second study is an animal study, which again, as this is an extension of the clinical study. Usually, it's in modern medicine, it's like, say, we do in vitro, and then we do we do preclinical, and then we go on to do clinical and all. Here, what we have done is we had already an evidence of Vasant Kusmakar having beautiful effect on diabetic retinopathy because of its effect on Dhatu Kshay.
A small gentle reminder, sir, if you can just complete in a couple of minutes.
Yes. So Dhatu on Vasant Kusmakar is acting on Dhatu Ksharan, Dhatu Kshay, Dhatu Shaithilya, etc. So what we were able to find out in this particular study was that Vasant Kusmakar has acted on different pathways. Some of the pathways which I would like to discuss over here. Number one is the oxidative stress. So Vasant Kusmakaras acts very beautifully on enhancing the oxidative antioxidant enzymes, the SOD, the catalase, etc. Then it also has a very fantastic effect on reducing the aldose reductase enzyme, which is again responsible for creating diabetic retinopathy. It had a wonderful effect on VEGF, the vegetative endothelial growth factor, which is again a contributing factor for diabetic retinopathy. And then last most important thing is to decrease the vascularity of the ganglionic cells. So this was again based on like say evidence what we were able to create. These are the graphs that you can see. This is the normal control versus the Vasant Kusmakar, and then this population not receiving the intervention. So those group of animals which are not receiving the intervention did show a very significant reduction, whereas this the SOD and the glutathione levels showed a very beautiful increase in the levels, while the lipid peroxidation showed a decrease. Again, on the aldose reductase activity, so on the diabetic control, you see the raised aldose reductase activity, whereas on VKR group there is a significant reduction in the aldose reductase activity. Similarly, on the VEGF, you find a fantastic reduction in the VEGF levels as well. Most important is this particular slide, where you see the loss of pericytes, what we call it as one of the contributing factors, or one of the like the critical factors for like diagnosis also, and the pathogenesis of diabetic retinopathy. Here the pericyte cell loss is not there. So this figure and the third figure, you can see it's absolutely more or less the same. Whereas this is the normal control. The first one, A, and the C one is the diabetic, is the VKR group, whereas in the non-treated one, you see a lot of pericyte loss happening. Thank you very much to the organizers once again for allowing me to make my presentation and giving this opportunity to be part of CAR. Thanks a lot.
Thank you, Dr. Sanjay ji. Your presentation was truly remarkable, because most of us Ayurveda practitioners know about Vasant Kusmakaras, and for the wound healing we know, and many of us have used Panchvalkal Kashaya and Jatyadi Grit. You are creating evidence through your scientific rigor. So thank you so much for sharing. Now I would like to invite Christian Rakwiz. He is going to talk about osteoarthritis and basic research.
Dr. Vandana, could you please make the announcement?
Okay, yes, I would like to announce and request all the participants. Can you please post your questions if you have any in the message box? Thank you.
Hello, can you hear me?
Yes.
Yes, okay. So I will start. Thank you very much for this invitation to speak at this council. And as already Dr. Vandana said in the beginning, I'm a doctor for general medicine and emergency medicine. So I come basically out of the field of conventional medicine, but I've also studied Ayurveda at the European Academy of Ayurveda that is close to Frankfurt in Germany. And what I'm talking about today is a research project between the European Academy of Ayurveda and the All India Institute of Ayurveda in Delhi. And at this point, I'd like to thank Professor Dr. Tanuja Nesari, who's the director of the All India Institute, because without her and her team, this research would have not been possible. So this is not just my work that I'm going to present here. Yeah. And out of this research, I'm going to talk about the two major topics now. And as you all know, Ayurveda is growing in its popularity all over the world. And because of this popularity, there's also an increasing demand on Indian Ayurvedic plants, especially for export reasons, and into foreign countries. Yeah? And many of these plants you can only find in conservation areas like the Himalaya region, for example. And what is happening then there is the destruction of the environment, on the one hand, and what is happening on the other hand is there's a distinction of rare plants, what is leading to a major problem in near future. And in this question, we try to answer, basically follow like two main questions we'd like to answer. On the one hand, is there a way to implement plants from other countries with unknown pharmacological actions into the system of Ayurveda? As you know, the approach is different from conventional medicine because you have, for example, Rasa, you have Virya, you have Vipaka, and you don't know anything about it of other plants, basically, and how to integrate this. And the second question is like, once we find a way to implement these plants into the Ayurvedic system, is there a way to find out new modes of actions of these foreign plants and to develop new medical remedies in future? So, and the research is going to be about two plants. This is one well-known Ayurvedic plant that's called Vitex negundo, and the European sister plant, so-called, because it's out of the same plant family. We've chosen Vitex agnus castus. And Vitex negundo, basically, you all know because of its anti-inflammatory action, and both leaves and fruits of this plant are used. The Vitex agnus castus that is used in Europe, I'm not sure about US, but it's mainly used in gynecological problems like amenorrhea, for example. And out of this plant, just the fruits are being used, and there's not been any relevant research on the leaves so far. So we don't know anything about it, basically. So, and the research is divided into mainly 4 steps. What we do in the first step, of course, first of all, we have to cultivate these plants, especially if no one uses for example, the leaves of Vitex agnus castus. It's very hard to get a huge amount of leaves. This is the first start. These are some problems we are dealing with right now. But once we have enough plant material, then it comes to step 1, what is basically a phytochemical analysis of both plants with many different analyses, so that we know each and every ingredient basically of the plant. Next step is, for example, DNA fingerprinting, screening for active pharmacological substances, and also we do, for example, a Rasa determination, by 2 different methods. On the one hand, we do it by volunteers. On the other hand, we do it by technical features we can use in this way. And also we do an in vitro screening on a cell line for antiviral activities for the actual pandemic coronavirus. Step 2 is going to be an in vivo testing on mice, where we test acute oral toxicity. For example, if you want to develop any kind of medicine to be taken orally, so we need to know the threshold for the oral toxicity, and we are going to do an anti-inflammatory simulation by inducing a granuloma pouch, for example, and trying to induce osteoarthritis in a mouse knee. And this in combination with computer simulations to find out the correct dosing of the later on developed remedy. Step 3 is going to be the development of a new drug. It's either, for example, a new biopatch out of this plant material that we can put on patients with osteoarthritis of the knee. So with different plants out of these 2, either leaves, fruits, and so we have 4 different patches. And we can also think about developing an oral remedy to be taken for later on studies. And step 4, the last step, is going to be a study on patients that is going to be conducted in Germany and India, multi-centered. And there we are going to try to find out if this, what we've developed before, the biopatch or the oral medication, works actually in patients. So what we are trying to do with this study is basically to create an SOP, so a standard operating procedure on how to integrate foreign plants into the Ayurvedic system. So we can do this with any other plant all over the world, basically. So we don't take it all from India, so we can respect the desha, so the place where the plant is actually growing. And in future, as I said, many other plants can be tested, what can also lead to many other pharmacological remedies that could be identified in future that we couldn't even know of right now. Yeah. So we have two things. We have basically the basic research, so-called, and we have a study on patients with osteoarthritis, multi-centered and international. Thank you very much.
Thank you, Dr. Rakvez. It is actually such an enlightening talk. You covered all areas of Ayurvedic practice and research in a brief time, working on patients directly and thinking about the sustainability and availability of herbs, and having some simulation, study those at simulation model, and where we are not sure about how to research, like Virya, Vipak, Prabhav, and if these can be used by the scientific world without knowing the action. It was absolutely a very enlightening talk. Thank you so much. And now I would like to invite Dr. Ashwini Godbole. She is going to talk about cognitive impairment and neurodegenerative diseases. Welcome, Dr. Ashwini.
Yeah. Namaste, everybody. Am I audible?
Yes, you are.
Yeah. So first of all, I'm not a Vaidya. I'm a very alien, so to say, to this forum. And thanks to CAR to invite me here and giving me an opportunity to talk to all of you, all Vaidyas here. And let me see if I can reach you through my research, which is about Ayurveda biology, as we call it. So I'm in TDU, Transdisciplinary University in Bangalore, and that actually is the best place for a person like me who's coming from biology and trying to very highly interested. First of all, is big fan, I should say, of Ayurveda, and now trying to do research in Ayurveda. And as a basic scientist, as a biologist, I think what brought me to Ayurveda and what actually keeps me here, like the attraction is ever growing, is the positive and promotive health which Ayurveda offers. So Ayurveda is not about diseases, and that's what attracts me to Ayurveda. It's not only about treating diseases. So it's all about health, and that brought me my interest in Ayurveda and especially to cognition, because I saw that aging, we are all, the population is getting older and older. That means we have many elderly with us now, and we want to take care of them. And Ayurveda has a beautiful concept of Rasayana. And when I came to TDU first and I started working on in the field of Rasayana, I saw that there is a very systematic thinking about Rasayana, and that is about Shrota Shodhana, Agni Vyapara, and Poshana. And that I was so very impressed with that kind of thinking, which does not exist in modern biology or biomedicine. And that actually, on that note, I started with cognition. And I'm not showing slides today because one is that I just wanted to talk to all of you and show my, not to show the hardcore data, but to say that what actually research which we are doing, the concept of it. And last CAR event, I actually showed a lot of slides in very short time. So I thought today I won't do that. So what we are doing is doing both clinical and the basic biology work at the same time. So what I say is that we do zoom out and zoom in again and again. And that place like TDU, which also has a hospital and a clinical team, Ayurveda experts and biologists, allows me to do that. I go to the clinic, I see how people are treating, what they are treating neurodegenerative diseases or age-related problems. Then I come back to the lab and try and set up the experiments by using that knowledge which comes from the clinic. and the concepts of Ayurveda. So concepts like Rasayana and practice of Rasayana and the practice of geriatrics actually has helped me a lot. So coming to the first topic, cognition, I bugged my Ayurvedic friends saying that tell me one thing which you can as a positive and promotive practice, and there has to be only one formulation which I can apply in the community. I don't, because it's a community research. If I and the people don't have any problem. They are just at say 45 and above. We have seen there are changes in cognition. Your active thinking, sometimes some of the cognitive memory domains will start giving you an alarm saying that okay, look at us now. So then that's what we want to do. That they really don't have any problem. Why will they take medicine? I want to give something which is similar to food and can improve your health. So it's positive, promotive health, and we got Brahmi Grita and we started working on it. And so we are doing a community-based clinical study which involves Brahmi Grita, Brahmi extract. Brahmi means Bakuba Munieri, and Brahmi Grita, which is traditional formulation. And to have a good control, we have had Brahmi extract. And the data till now, because it's a community research and it's healthy people, we have to collect a lot of data, and data till now shows that if Brahmi Grita is taken properly, it really doesn't have any too big a problem with lipids and things like that. And in fact, it gives a lot of benefits with auditory memory and also the logical memory. People who have really low logical memory sometimes, mainly above 65 years old people, above 65. And that's what we have seen. And what a pleasant, what we got very good results was on sleep, because we are doing all questionnaires also, and people, it's a problem, it's epidemic. Lack of sleep and lack of good sleep is a big problem. And if Ayurveda can help, Ayurvedic concepts and medicine can help, or formulations can help, this kind of day-to-day small things, I think the quality of life will go a long way, like it will improve a lot. And that was the concept in cognition research. And as I go back to the lab, I have a model called C. elegans, which is a tiny little worm. Though it looks very different from human beings, it has a lot of similarity when it comes to nervous system function. And that's how we can keep using. And you won't believe me, but we have experimental data where we have shown that the memory of C. elegans, those nematodes, is actually much better if they are fed with Brahmi. They live much longer if they're fed with Brahmi Grita. And to our good surprise, we have seen that that if we feed only Grita, plain Go Grita, then also we get a lot of extension of lifespan. And we are trying to look at the molecular details of that and the cellular details of that. And that my lab models allow me to do that. And then the clinical, it's actually very gratifying that we can see the changes at the community level. So coming on similar way, I have we have some clinical research results from clinical research on Parkinson's disease. And as you know, unlike just age-related cognition, Parkinson's disease, there is a treatment, there is a Chikitsa Sutra, there is a sutra which is used by Ayurvedic physicians. And actually, I sat and discussed with multiple rounds. We have discussed about what if the PD person, the person who has Parkinson's disease is showing certain symptoms, what will you give? And then we selected 6 herbs, which we brought back to the lab and again did the same trick. That we have Parkinson's disease models in the lab, and we have tried using each singular formulation, not the active component or not the extract. Means if it is Kapikachu, then it is Kapikachu Churna. Then we have tried to use just the water extract of that, or if it is Ashwagandha, then similarly, if it's Grita, then we have used Grita in the lab, and that's how, and we keep all the controls, and that's how we are able to do something which at the clinical level, at the same time trying to do
Ashwini,
something
ma'am, a gentle reminder, ma'am,
where molecular and cellular details can be studied. So this is what our experience with Ayurveda, but the one big aim I have is that Ayurveda should be used for promoting health, that is wellness. And also we should be able to offer some formulations to the healthy population, which is food-like formulation. At the same time, these formulations have to be very properly scientifically studied. And if somebody asks for evidence, I should be able to offer it from molecular details and the cellular details. So that's our effort. And I'm glad that a lot of my Ayurvedic friends have accommodated a scientist like me without any problem. And we have a good team. We have cognitive neuroscientists in our team. We have biologists like me in our team. We have MRI experts in our team, and then we have a lot of Ayurvedic doctors in our team. So that makes a very good integrated team. So that's our experience with this effort of developing evidence for something which is a very strong point of Ayurveda, which is Rasayana, which is for wellness and health. So thank you for letting me share my experience here.
Thank you, Ashwini. Actually, I want to apologize. I see you a lot on Ayurveda forums, and you kind of seem like so expert in Ayurveda. You are so expert in Ayurveda that I addressed you wrongly. My apologies.
Yeah,
you are
no
a
problem.
scientist and a
I hope I can
biologist.
do BAMS someday and become actually BAMS. So I'm waiting for that day. Yeah.
And I'm really very happy to hear that also. There are like Christian, there are people from contemporary medical sciences who are interested in Ayurveda, and the scientists like you who keep our hopes high that we would be able to generate the scientific rigor or evidence base that we truly need to bring more credibility for the scientific people who find it hard to accept Ayurveda. So thank you for sharing your work. And I really like the idea you promote wellness, like Swasthasya Swastharakshanam, promoting wellness. And I will be talking to you more in our discussion session. Thank you so much for your presentation. The scientists and Vaidyas and the doctors at TDU are doing amazing work. Thank you for bringing it to us. Now, I would like to invite our next esteemed speaker, Vaidya Vidya Bhushan Pandey. He is going to talk about cerebral palsy and malnourishment. Welcome, Dr. Vidya Bhushan Pandey.
Thank you, ma'am. Should I start?
Just 1 minute. Before we start, you are our last speaker, and I just want to request all our panelists not to leave, because the next round is discussion round, and we will be firing questions on you guys, which our volunteers are collecting and collating from the audience. And I request our audience also, who are present here, do not hesitate to write down your questions in the chat box. We have our volunteers who will collect and collate it, and I will get your answers from our presenters. Thank you. You can start now, Dr. Vidya Bhushan.
Okay, thank you, ma'am. As you all of you know that I'm going to talk about two subjects, like one is the cerebral palsy and other is malnourishment. So I'll focus on the malnourishment first because it is most general and public-based topic. And all of you know that we are doing the discussion on the Ayurveda Day, and the Poshan from Ayurveda is the subject of this Ayurveda Day. So people are mostly focusing on getting how to get maximum nourishment from the Ayurveda and Ayurvedic concepts. So there are so many things the government is doing. In the last September month, the Poshan Ma has been celebrated all over India. The people have done lots of things. It is divided into 4 weeks with different subjects. So many things has been done. Still, there are some problems that we have to see, that our India is still on the on some data are there, like on the 94th position in the World Hunger Index and something like that, and we are still being a developing countries. We are behind Pakistan and etc. and other developing countries whose economy are not as developed as our. So this is some concern topics that we have to see in the malnourishment cases. So if we will see that because of lots of work, we still not able to cover up the malnourishment. Still, the malnourishment is covering 12% of the whole burden of the diseases which are occurring in the pediatric section. And other thing is that about 11% of the whole world population is undernourished. So there are lots of concern about the malnourishment. So what can we do? What can the Ayurveda do? Why the topic is given in this Ayurveda day? So a portion from Ayurveda. So now the world is talking about Ayur nutrigenomics. The term is going on very much. Ayur nutrigenomics. That means it is the topic that is concerned with the personalized nutrition to anyone, and it is based on the Prakriti-based work. And if you will see that every person is individual from one another, has different physical constitution, mental constitution, all the things are different. And that is what the main concept of the Prakriti. When we go to the public, we find it is difficult to give a general, when we go to the public and we try to frame Ayurveda concepts to the public like Ahar Vidhi Visheshayat, and it is very easy to talk, but it is very difficult to do the practical job when we are going in the social and public fields. And if you see in India, there are lots of still lots of poverty. However, the people cannot afford. And by Ayurveda, we need a quick work, a quick concept which can give a good result. So if you will see that this Ayur nutrigenomics, which is one of the emerging topics after the Ayur genomics of, you can say that this topic has emerged, having the Prakriti analysis. So in one of the research, because of some technical problem, I'm not able to show you some data in PPT. I will just talk about them. So in some of the research, it has been seen that Vat Kaph Prakriti is the one of the most involved Prakriti when 1,000 or something 1,400 people were analyzed, and of which 200 people are found undernourished. Vat Kapha is the most vulnerable Prakriti which is found during the analysis. And it may be because of some Vatic Prakriti still, it is still, if you see the features of the Vat Prakriti, it is very close to the people which is very thin and lean and is very active. But when the Kaph is involved, then there is a Srotorod. That is why the Vat Kaph Prakriti is most involved. Later it is followed by other Prakritis. So this favors the concern of this Ayur nutrigenomics, Prakriti-wise analysis and Prakriti-wise diet. So this is the key. This will be a key when for the public health like cases when we are going to deal malnourishment. Similarly, there are some more work, like some more things by which we can deal this malnourished malnourished topic, like Snehana. Snehana, you all know that, and Snehana is very much effective in the child age group of 1 to 3 years, because in that time the skin is very much nourished to take the nutrition from the oil. So it is said that Snehana is very much effective to deal with the undernourished or low birth weight babies. Second, when we go to the age group of 10 to 14 years or 1 to toddler age group, then Deepan Pachan, and along with that, the nutritious herbs and drugs, and again the very nourishment, having foods which having lots of nourishment like til laddu and like khajur, like that, along with the mixture of the Ayurveda drugs, they are very much effective. So Ayurveda laddu, Ayurveda biscuit, and lots of work has been done in the Jamnagar and in NIE research institute. So this is the key thing which will be beneficial in the management of malnutrition. Then I'll come to the topic of cerebral palsy. It is, however, it is not common, but it is commonly occurring from 1 to 2 per 1,000 incidents. Now it has become 4 to 6, 1 per 1,000 in the cerebral palsy. So it is very commonly occurring nowadays. If you will see that around us, about 1 to 2 families having this problem, their children are not able to walk, their child is not able to walk, and he's suffering from problems like spasticity and all. So it is regularly going on increasing. What we can do, what Ayurveda can do, and what everybody is doing. Everyone is physiotherapy and all the allopathic modern practitioners. What are they doing? They are actually improving the functional capacities of the cerebral palsy affected child. What we can do specially, what our concepts of Ayurveda can help in increasing the functional capacity of a cerebral palsy affected child. So all of us know that spasticity is the most occurring, most commonly found cerebral palsy variant. So if you will see the Patta Bandhana is one of the basic and one of the basic therapy that is given by the Sushruta in the Vatvyadhi chapter. So if you will tie a simple crepe bandage in a proper manner in the spastic on the spastic limbs, you will find two things which are occurring at the same time. One, you will properly align a child to a spastic child for the proper ambulation, and slowly you will see that there is a decrease in the spasticity also. So it is a long-term gain, but at that time you will find that he is able to stand properly. Similarly, Matravasti from different drugs are also helping. If I'm allowed to give a small PPT, I hope I think now I can present that. Hello.
Respected Pandey sir, sir,
yes.
Just a reminder, sir, we are running a little late, sir.
Okay, sir. Okay.
If you can complete,
now I'll leave that PPT. I'll just show a light on what is happening in the cerebral palsy research in India. When in the CTRI, I found that 24 research have been already done in the different institutes, of which maximum research is done in the Jamnagar, followed by the NIE, BHU, and All India Institute of Ayurveda, etc. And then when I will concentrate upon the international clinical trial, then I have seen that 9 trials have been registered on the cerebral palsy and Ayurveda. So I can say that now the cerebral palsy, which is one of the most problematic disease, child and his parents regularly suffer through their life because of this problem. This can be managed in the Ayurveda properly. Thank you very much. These are my two topics. I hope the people who are joined in this session, they will gain something from this speech. Thank you.
Thank you so much for your talk and presentation, Dr. Vidya Bhushanji. It is just that due to the limitation of time, which we have already communicated, we could not allow you to share the slides. Definitely, we will invite you in one of our webinars or clubs and give you the chance, and where you can enlighten with your research work and the knowledge that you have accumulated from your clinical practice. Thank you so much. It definitely is a burning problem of the malnutrition, and it is also very, it is a matter of concern, the rising cases of CP. So I have your questions for you. I would be bringing it in discussion session. I would like to conclude this session, the second round of presentation session. Everyone who is present here, who has attended the sessions, will agree with me that it has been a remarkable session. Although the time allowed was brief, they had the running short of the time. They all felt that the time is short, but the presentations were very informative and educational. And not only for Ayurveda professionals, but for the layman audience, if someone has joined, how they can understand and bring Ayurveda into everyday practice with the support of this research and evidence base. Vaidya Sumit has shared that no single drug is effective in isolation in osteoarthritis. And the one thing I found interesting was that we can bring placebo in Ayurveda, and he has shared that 36-week disease activity score. And I'm wondering that this 36 days activity score, where we can make interventions with medicines and see results, is very interesting. And this finding that neutrophils have this, neutrophil is important for cell-mediated increase of immunity, and this helps in customized approach the Ayurveda advocates. So this is definitely a very interesting finding for Ayurvedic herbs and the approach. Our second speaker was Dr. Hina Bhatt, who has brought the whole system approach for PTSD and advocated this non-pharmacological approach through meditation. And I'm wondering that if she has presented her study as if she has got it published or not, that I would be bringing for her in our discussion session. And highlight of epigenetics and use of ekal dravyas is also very interesting. Dr. Sanjay Tamali has shared his work of Ayurvedic formulations in Ayurvedic, diabetic retinopathy and diabetic foot, which was very interesting and enlightening research work. And Christian's work is also very interesting because he happens to be the doctor of medicine. He understands that part as well as Ayurvedic medicine. He brings that conventional as well as Ayurvedic medicine in front of the world for everybody to understand and make it more acceptable. And he has covered, like I said before, the whole perspective of Ayurveda studies, research, and practice. Dr. Ashwini, though she comes from the background of science and biology, her work in cognition and positive promotion of health and the work on Parkinson's brings the rigor of science that Ayurveda needs. And of course, Dr. Sanjay Tamoli's work on malnutrition and spasticity in CP is interesting. So thank you so much for sharing your work, bringing this in front of our audience today. We are very thankful and grateful to you. I would open this, we would now start our next session and open for open discussion round. So can we please have everyone on the panel for question answer round? Thank you. So Dr. Archana, can you stop highlighting me and highlight the Dr. Sumit Kumar, because my first question is, I would like to ask my first question to Dr. Sumit, that Dr. Sumit, your work is very interesting on osteoarthritis. So I just want to ask you, did you face any hurdles while with the patient compliance when you, while prescribing this Ayurvedic treatment to someone?
Yeah, so I would like to first just make a small correction. It is rheumatoid arthritis, not osteoarthritis.
Oh, sorry. The Christian is talking about the osteoarthritis, and my mistake, my apologies. So,
yes, so patient compliance, especially in Indian population, is a big risk as well as an effort. What we have seen is if you properly motivate and keep on, because we are running several clinical trials based from DMD, from small kid to rheumatoid arthritis, which affects mid and old age people. So basically, we have to see that how we keep the motivation and connect with the patient, keep on weekly calls or 15 days once calls to know whether they are taking their drugs. And of course, there are other methods where we tell them to bring back their bottle which we dispense them, and we measure them how much quantity of drug is still left, and all those things to see. So what we have seen, and that 80% compliance is a very kind of, very, very practical expectation you can see in a good control trial. So 80% trial compliance we have seen, irrespective of socioeconomic status, education, or anything. If not, we make our point that people who are not 80% compliant with the medicine, we take them out of the study.
Okay, yes, definitely it makes sense that if the compliance is not there, you take them out of the study. That keeps the research, maintains the quality of the research.
Yeah, and this as part of inclusion criteria. So it's not that we are doing at the time of statistics or anything. So so we have put it that only people who are 80% compliant would be taken for statistics. So it's clearly drawn in when we take the consent.
So you say that 80% compliance is there. So it is not very difficult for RA patients to follow Ayurveda.
Yes, so I think it was an Indian setting, and it's going to be now 3 centers. So we could achieve that, because ultimately rheumatoid arthritis, people really look for different alternatives. And if they have a substantial relief symptomatically initially, they're not worried about how much disease activity scoring is going to matter. So for them, C-reactive protein is not important. What is important is quality of life. So if we are able to, what we have seen within 3 weeks of therapy, we can give a very good symptomatic relief to patient through Ayurvedic therapy. So that encourages patient to stay to us. And so hereafter, how our clinical practice changed after this study, that if whenever we get a new patient of rheumatoid arthritis, we tell that, see, you have to be with us for 9 months without any interruption. So this is one thing which, as clinician, we have kind of quantified. If somebody asks how much time we require for you to take medicine, so we say 9 months or 36 weeks of uninterrupted study, drug compliance, 80% compliance for a disease activity, modification.
Yes, it makes sense. If they have this plan in hand, they would be more, they would have more trust in Ayurveda also, that this is this long I have to commit. So my next question to you is regarding COVID. Any evidence-based preventive Ayurveda measure for COVID in general?
Ma'am, I'm totally against this concept, or I'm not for this concept that you take this medicine and COVID not happen. I'm sorry for that. I'm not into that boggy, because I have seen many people taking loads of many medicines still getting COVID, or even we are doing as I told you, control study. We are almost now recently 80% of the people who are getting admitted are vaccinated, even 2 doses of vaccines. So what I see is our main aim of the study was not prevention of COVID or treatment of COVID. Can we attack the pathogenesis of COVID-induced inflammatory process? So we were looking at the biomarkers or molecular pathway, as Ashwini ma'am was talking about. Is it regulating relative gene expression in terms of IL-6, TNF-alpha, and a host of inflammatory cytokines, which are very important for such kind of buildup? And what we have done is, we did a proper kind of documentation of baseline when they are between 0 to 3 days of symptom till 7th day and 14th day, because the COVID is a day-based, 7th to 12th day is the most critical phase, where patient either go to ICU or death, or people who are naturally to recover, they will recover in those days. So it is very important to notice the build-up between 7th to 11th day of the clinical symptoms. So we have done properly documented it, and we see that Ayurveda group is performing much better than conventional therapy. Of course, it's an integrative virtue. So people who are on remdesivir, and both groups, they have remdesivir and steroids. But when you add Ayurveda, you see a better NLR modulation and a better IL-6 modulation on 7th to 11th day. This is a very important message, because that is the time where people go to ICU and succumb to ARDS. So this is very important for us to understand, and we are properly documenting, and it's first studies already under kind of review.
I totally agree with you that there is no backing for evidence-based preventative Ayurveda, because it has created the mass use of herbs by the Indian population at large. And I agree on the second point also, that integrative approach is the best approach to manage this problem. Thank you so much, Dr. Sumit. And now my second question, now my question is to Dr. Hina Bhatt. Dr. Archana, can you focus on her? Dr. Hina, you were talking about PTSD, and in that you mentioned that meditation as a non-pharmacological approach is one of the tools that helps. So can you share more how you recommend and help your clients do meditation? Because this is something very challenging for a PTSD client to sit down and calm their mind. Dr. Hina.
Yes, thank you, Dr. Vandana, for the question. And if you noticed, more than just meditation, the concept of Sattva Vijaya Chikitsa, which is explained in Charaka Sutrasthan, and the article that I was talking about, I have right here in front of me, very recently published, Nootropic Efficacy of Sattva Vijaya Chikitsa and Ayurvedic Drug Therapy. And it was a comparative clinical exposition. So the way I incorporate it in clinical Ayurvedic practice is, first step is always the counseling. Once we get the root cause analysis of where the trauma is hiding, once we have that, lot of counseling sessions helped the clients get to know their own root cause. So once they understand why this is happening and how to come out of it, that's when the family and the social support is the next important aspect, which also Ayurveda talks about. The way they say that it takes a village to raise a child, I would say even in clinical practice, it does take a village to, especially for individuals suffering from PTSD and leading to psychosomatic disorder. For example, the case that I presented, it does take a village to help the client. And now, even recently, the APA, American Psychology Association, they included integrative therapy and holistic therapy as one of the 5 major broad categories of therapies for PTSD. So that itself shows that, especially for the client where the root cause is at mana level, is at mind level, the sattva level, that's where Ayurveda excels, when you bring all of the whole system approach together. And I have to mention that, of course, the diet and lifestyle was more of sattvic. That's where we changed and integrated the Ayurvedic diet when he was on the diet prescribed by the registered dietitian here, which mainly focus on the sugar levels, but it doesn't focus on the mental level. When we changed the diet to sattvic ahar and the counseling sessions together, the meditation part was, of course, initially was not possible because, of course, the PTSD client is very unpredictable. So, but when the client himself, it's like empowering the patient himself, that yes, you have a problem, but yes, if you focus on your problem, you will be able to come out of it. So it's a combination of yoga therapy, meditation, counseling, and self-control, as Sattva Vijaya Chikitsa explains very well.
Good. You answered the question
That
very
answers.
well. Yes, I just wanted to know for my audience the tools exactly that you used, and you answered it very well. Thank you. My second question is related to eczema. What is your experience that only local application give result, or is there the need for Ayurvedic medicines to be given systemic, formulations that they have to take it orally and combined with lifestyle and ahar, vihar that we say in Ayurveda? Is this the approach we always need, or do you see result with local application also?
Yes, my answer for any successful Ayurvedic intervention is always whole system approach, because that's how classically trained Ayurvedic physician has learned to practice Ayurveda. So the Traya Upastamba, it is not just diet that will heal the condition. It is not just lifestyle that will heal the condition. And of course, it is not just the Ayurvedic formulation. It has to be the combination to have the successful healing process to take place. For eczema, yes. The particular case that I was talking about, and I had mentioned that along with the Ayurvedic diet and lifestyle recommendation, counseling sessions, and the meditation part. And it is amazing how this age group, as young as 11-year-old, could understand the concept of meditation. And when taught and explained in detail, he could do it.
Mm-hmm.
And that shows the power of mind over body. And that's what Ayurveda always advocates.
Absolutely, I agree with you.
Yes,
Thank you,
yes, it is a combination of whole system approach, no doubt about it.
Yes, I agree with you on that. The whole system approach is the way, and like in conventional system of medicine, people say that just the local application of medicines. In Ayurveda, we always advocate whole system approach. Thank you so much. My next question is to Dr. Sanjay Tamoli. You shared your work on diabetes. You are very passionate about diabetes, and it shows in your presentation, and you have shared your work about the formulations. My question is that, have you come across leech therapy for diabetes? What is your opinion? How effective is leech therapy for diabetic foot in particular?
Yeah, so absolutely, ma'am. This particular intervention by leech therapy is without question one of the best thing that Ayurveda has provided to the world. And there have been a lot of publications, a lot of work that when we were doing our post graduation, we used to apply left, right, and center. Everybody who is to come for leech there for like diabetic foot ulcers, varicose ulcers, non-healing ulcers, bed sores, etc. So there is no doubt about it that that therapy of leech is probably the best thing that I have come across, not only during research but also during clinical practice as well.
Okay, thank you, Dr. Tamoli. And my next question is for Dr. Christian. You shared your experience with local herbs on osteoarthritis. I just wanted to know, have you come across any limitations while using Ayurveda medicines and osteoarthritis, and felt during the treatment that your patients need allopathic drugs for acute pain?
Well, this research I was talking about, this is just basically a concept, and it's going to start in the next weeks, maybe for the next 3 years. But what I can say about osteoarthritis in patients that I see every day in my clinic, of course, it's different because we have a different approach. We have like 5 to 10 minutes for a patient to treat them, and it's different to the Ayurvedic approach to make a whole system approach, of course. And let's say many of these patients, they don't really ask for a whole system approach, because they come with an acute pain, they have some problem. Yeah, there are two different sorts of patients, and these, of course, you provide with active NSAR, NSAIDs, yes, these ibuprofen or whatever, to take away their pain, and so they can proceed with their work as well. So, and the other approach is what they do when they have osteoarthritis in a chronic state, and then we come to a limit in the clinical way, the conventional medicine, because you can do physiotherapy, but that's basically, yeah, that's limited as well, because you cannot give the patient physiotherapy all the time for like 20, 30, 40 times or whatever. You can give them for like 6 times, maybe 12 times, and that's all we have to offer. And then the patient has to find a different approach, and that's why I think this study we've set up, that we don't have to take this oral medicine all the time, this conventional medicine, because it has many side effects on heart, on liver, on kidneys, and maybe with this biopatch out of plant material, if this can bring any relief to the patient without attacking any of our organs, this could be a great step to relieve the patient. And this is of course, this is just a small piece. It's not an entire body approach, but it's just a pain relief, but still it leads to an increase of quality of life.
So you agree that it is an integrative approach, and thank you for your feedback. And my next question is to Ashwini. You shared that your work is on nematodes, the worms. So what made you choose nematodes to see the results of Brahmi?
Will you believe me that they are very similar to human beings? That's why we chose them. That's how they are. They are 60 to 70% DNA is same as us. So they have genetic similarity, one thing. And the nematode is 1,000 cells. 1,000 cells, 309 of that is neurons. So 1/3 of its body is neurons. It's a very intelligent, I can go on talking about the C. elegans forever, but we can do chemosensation, mechanosensation, memory. We know which neuron is actually going and making synapses with which other neuron, which we know that which neuron is actually innervating the muscles, digestive system muscles, body wall muscles. So much information is available about that worm as an organism, and it's an excellent model for aging. And the results from our study and the earlier studies show that the aging and neuro functions goes hand in hand in worms as well, which is very similar to human beings. The nervous system aging is a big part of aging as a process. So that's what we actually see a lot of similarities. And then the worm actually allows us to look at it at the minutest level, like molecular level and the cellular level. It's a transparent worm. We can put fluorescent proteins and so on. So that's why it allows us to do, it has a lot of tools which makes us use a lot of tools which are available in biology research. At the same time, keeping the organism context. So both ways it helps.
Thank you, Ashwini. I have many questions for all my panelists, but due to the time constraint, I will just shoot my last question to Vidya Bhushan. That what is your opinion about use of Swarnaprashan? Because it is gaining so much popularity in India. So does it plays any role in malnutrition? Can it be used, or it is just for immunity building? Or what is your thought about the use of Swarnaprashan?
Actually, Swarnaprashan is nowadays booming very much, but Prashan is not the synonym to the Swarnaprashan. Prashan contains many other things, like it is basically the Lehana process. When you go to the Lehana of Kashyap Samhita, you will find so many drugs like Shatavari, Shankhapushpi, Brahmi. They are also asked to give in the Prashan form. but because of having Swarn, most probably, or having a good immuno-boosting property, the Swarn Prashan has got very much booming thing nowadays. But in my experience, I have given some newborns who are low birth weight of below 2.5 to 2 kgs, Shatavari Prashan with the 4 pinches of Shatavari with the mother's milk, and they have gained a good weight, and within some days they have within some months they have got appropriate weight according to their age. So Prashan is not limited to the Swarn Prashan. It has so many contents. It has other nutritious drugs, and yes, Prashan is related with Agni Deepan, increasing the digestive fire. So it is not actually nutritious in itself. It is just flaming the fire inside us. So after giving Prashan, if you will give a proper regular diet, it will work a lot.
Thank you so much, Vidya Bhushan ji. Now over to, I just want to thank all my panelists for wonderful presentation and interactive session. Now over to Vaidya Ritika. Can you please conclude the session, Ritika?
Yes, thank you so much, Dr. Vandana and all the panelists. Thank you so much. I would like to thank to each one of you for taking the time out today and joining us today. Your presence made this event memorable and a great success. I would like to thank all the panelists for joining us today, taking the time out, and Dr. Vandana for the greatly informative and stimulating panel discussion on various research topics about Ayurveda. I would like to express my gratitude to Dr. Rajesh and Dr. Archana, who so generously and constantly helped us making this event together smoothly. Thank you, Dr. Pratibha, for the constant support. We couldn't have done it without you. I would also like to thank Dr. Abhishek and Dr. Pranita from India for their contribution. Thank you everyone for making this event a success. Thanks a lot. Just a couple of announcements. You can become a member of Council of Ayurveda Research by clicking on the link in the chat box. And if you like to volunteer with us, you can email us at ayurvedaresearchusa@gmail.com. I would like to repeat, ayurvedaresearchusa@gmail.com. You can watch this event again or more videos related to Ayurveda research by subscribing to our YouTube channel. You can share, like, and follow us on Instagram, Twitter, and Facebook. Thank you, everyone. Thank you so much. Stay well. Hope to see you all soon in the next event. Thank you so much. Namaste.
Dr. Ritika, could you quickly announce about the membership by tonight and the
yes. So if you become a member tonight on the 6th of November, you will be able to receive certificates, because certificates are only open to members of CAR and AAF. So you can become a member of Council of Ayurveda Research. Thank you.
Thank you. Thank you so much. We also conduct monthly global webinar series and journal club meetings. So I will certainly be reaching out to all our esteemed panelists to explore bringing you for a more detailed presentation. Sorry, today was the format was brief. That is the format of a panel. So we could not have full-fledged presentations. But thank you for spending your time, your knowledge and expertise with all of the attendees. Really appreciate it. Thank you so much. Namaste.
Namaste and thank you, everyone.
Namaste.
I'm going to request the team to stay back.